then I can also take a look at it and also try to answer it at that time. So please do not feel that you're disturbing or something, and we would like to keep it more interactive, and just to make sure that you are getting here the maximum benefit out of this session. Now let's start with what exactly is telemedicine. You might have heard regarding healthcare, and telemedicine is one of its subdomain. And so here, actually, telemedicine, it can be actually thought as it is that you are getting the care without going to the clinic. And so it can be delivered remotely, or it can be done through technology. And so some amount of technology will be involved. And the role of one physical establishment that you visit for your healthcare, for example, to a hospital or to a healthcare facility, that will be reduced in telemedicine. And so that is a broad definition here. So we'll be talking about its overview and evolution in India, and what exactly are the important factors for success of telemedicine. For example, that if the patients are not engaged well, then we have seen from the foreign countries that these telemedicine platforms, they are not very successful. So it remains really critical that this patient engagement has to be really good. And we will also see how this digital healthcare, it can be transformed through natural language processing and AI technologies. We will also have deep dive into one of the projects. I know that we have 1 hour 30 minutes, and there is a lot of content to cover. So we will just go and start and see that as much material, and so that can be covered in this particular session. Okay. So telemedicine, as I have already mentioned, this is remote delivery of healthcare using digital tools. And typically here specific like methods are used, like video consultation or remote monitoring, or e-prescriptions. And its market size is projected to reach around $460 billion by 2030 in here in this entire world. And for here telemedicine in India, and so I believe that it was and so it became almost evident to everybody that these telemedicine practices should be in India when we were facing COVID. And at that time also, you would see that at that time, the government of India, they had adopted one telemedicine practice guidelines. It was in the year of 2020. And also in India, we expect that by 2025, that size of telemedicine market industry, it can be around 47,000 crores. And now as we have access to data, and also we have access to technology, and so there is also high probability that all of here actually these kind of industries, they are getting a lot of leverage out of these technologies. And in India especially, there are some unique healthcare challenges. And with respect to India and the world. And when we look at India, we know that here in India, India has a very high population, as we know, and everybody's need for diverse healthcare is different. And also we have urban areas, rural areas, and we see that especially here in the rural areas, the access to healthcare is abysmally low. And so people do not have access to quality healthcare. And in case they require any kind of healthcare, they need to travel to the nearest town, and they need to go to a location where the doctor is available. And the second challenge that we have seen is shortage of healthcare staff. And so that again, we are saying that healthcare staff, when we are considering for per 10,000 population at one area. And because India has higher population, so that here the density of healthcare staff is also low. And I was just reading one statistics, and I believe that in the developed countries and whatever is the number in India, that is around 1/5 of that. And so from that point of view, and so it is felt that here actually we have some shortage of healthcare staff per population. And also India has many states, and all states have different languages, and they have multilingual requirement. And sometimes there are some language gaps. Let's say the patient knows one language and the doctor knows another. And so that and so that process of healthcare or the delivery of service, that becomes inefficient, and it takes more time, and also patients and so they are not able to understand, and also they have to spend some time to explain all of the prescriptions, and all of these things come in. And here actually all of these unique challenges, they can be solved through telemedicine, and by using this tools of NLP and AI. And this telemedicine platforms, and so there are and there are many telemedicine platforms in India, and but these are basically and actually two important ones, and also there are many others, and but these are actually two prominent ones. Typically, they have these features that, and here it is essential that they will have a digital health record. Digital health record means that, and so whatever the health records or any kind of consultation, all those prescriptions, they have to be kept and digitally on the platform. And if it is kept digitally on the platform, that helps in the access, and also as well as that opens other pathways that it can be used for other analytics methods. And so that is why it is important that all of these platforms, they need integration with EMR. EMR is nothing but electronic medical records, and so that can be e-prescriptions, and also, and so recently India started ABHA, and so which is nothing but digitization of the health record. And also, we have seen that when these records are digitized, then also patients are able to access them more efficiently, so that here they are satisfaction as well. And also doctors typically do remote consultation through a video or chat. And these platforms, they have multilingual interfaces. And remote monitoring is nothing but doctor is at one place, and they might have another location at one of the rural areas or one area which is far. And so that particular location will have basic setup, and the doctor will be able to see the patient and also diagnose everything, and by using technology. And that is the remote monitoring. And sometimes also these platforms, they do provide some dashboards so that the patients are able to continuously monitor their body parameters or their health parameters. And so, for example, your glucose, it can be, and so different blood reports, and so you can see the trend of those. And also there can be chatbots that the patients can use to identify their symptoms, and to identify that what exactly might be the disease that they are facing, and so that here they are more informed while they're talking with the doctor. So all these things, they will help in the patient engagement, and also in making sure that the patients and so they do feel connected with that healthcare platform. And let me just here maybe go to one example, and I will show you. So this is the website of eSanjeevani. As we can see here, that you can see its vision. It says that, and so this is an initiative by National Telemedicine Service of India, It's a step towards digital health equity to achieve universal health care coverage. It facilitates quick and easy access to doctors and medical specialists from your smartphone. And these are some of the features that here they are offering. Okay. And like in case we want to see Practo, we also go to Practo. This is a website of Practo where you can see that you can do instant video consultation, and you can also here keep your records digitally, find doctors nearby. These are actually not exactly telemedicine, and so Practo is actually more than telemedicine, but actually one of the components that Practo addresses, that is telemedicine, and that is why I included this particular example. So all of these features are available. Okay. Now, and so typically speaking, and whenever you look at one of the telemedicine platform, it's here its success factor will depend on three criteria. And number one is how effective is the diagnosis and the consultation. And so, for example, that in case you do your consultation through video, but you are not very satisfied with the resolution, then the entire goal of this healthcare and so that cannot be met. So that is why that it is important that the same standard for healthcare delivery it remains like here, even if when it is done through here these remote methods. And number two is affordability. And because here doctors do not need to travel and technology is heavily used, it is possible here actually to provide these healthcare in an affordability basis. And finally, as I have already mentioned, that actually here that patient may feel engaged here to that particular platform. And all of these three factors will be essential for success of any of these telemedicine platform. And I have just one question to the audience here. Have you ever seen any doctor through video conference? Can anybody share any experience there? Did you like it? Was it effective? Not effective? Okay. Yeah. Then maybe they here in the interest of time, we will go forward. Now let's take a look at the telemedicine policy landscape. Especially when we are talking about telemedicine, there is a lot of digital records are used, and that is why there are strict regulation how that data of patients can be used. And so, and all across the world, there are many data protection regulations. They are nothing but one comprehensive privacy and security laws, and here basically. Uh, uh, and here basically here these rules specify that how these data is to be collected and processed, and also how it can be transformed or maybe aggregated. And you might hear regarding these two terms very frequently, and that is number one is PII, that is personally identifiable information. It can be email, phone number, or and so any information that can be used to identify you. And PHI is protected health information. And so it can be your blood report or any other health report. So and so one organization they cannot use this data at their will. There are strict regulations, and if these organizations are planning to leverage that data, they have to follow these regulations. And there are a couple of examples that I have shown. For example, India. Yes, madam. Two messages has come into the chat box.
Like AI has written that it's effective eye checkup through Arabina Eye Hospital. And Deepalika Das ma'am has written during the COVID time when doctor is out of station, it is effective through video conference.
Yes.
It means the participant has already gone through that phase.
Okay. Yeah, so that is good. And so sometimes actually I have seen that some people feel that it is not very effective, but I have seen that for something really quick, and especially during scenarios of COVID, and where and so it is not advisable to travel. I think these kind of telemedicine they can be really helpful. Let me see also the chat. Right. Okay, here there is chat. Just 1 second. I would like to just read through the chat till now. Okay. So many people have responded to that question. Thank you very much for your participation. Okay. Now let's go to the next point here. There are some example of the guidelines that in India we have telemedicine practice guideline that came in 2020, just after COVID, that legalized here teleconsultations in India. And also we have Digital Personal Data Protection Act 2023, but it is not fully enforced yet. And so let me ask another question, and I would like to also, and also I would like that actually folks should respond in the chat. Have you ever sent one of your health report and to somebody else through WhatsApp? Maybe to get their opinion or to show it to a doctor? Have you sent it through WhatsApp, or you are protective regarding your health report? Okay, I have seen that actually a couple of participants, Yadipalika and Rumana, and so both have mentioned yes. And so, yeah, so we do see that in India, especially, I think that sense of data security and data protection, so that has not been implemented yet. But I think once it is implemented, then I think all of this awareness will be created that we need to treat these information of PII and as well as this PHI as confidential data. And so, for example, and actually there are some confidential data that we do not want to reveal it to anybody. So these two here, basically these two data actually come in that category. And so we have to treat it like that. And in India, and here in India, basically these were the two guidelines. And in USA, we had HIPAA, and in the European Union, we had GDPR. So the GDPR is, again, it is one regulation that actually mentions that anybody who is treating with any person in European Union, they have to follow these guidelines. And so whether you are present and whether the organization is present in European Union or not, that does not matter. But if you are dealing with a citizen, then you have to follow all of these guidelines. So these are pretty strict. And so typically speaking that when we are handling this medical data for our research or maybe for our aggregation or analytics, and there are a couple of best practices that we can follow. That and also almost everywhere and by the healthcare laws, it is established that all the patients have right to privacy. In case they do not want their data to be used for any kind of research, then we cannot use that. And so that is why it is essential that we do seek their consent. If we do not have their consent, then that data cannot be used. And so those consent forms, they have to be actually signed. And also sometimes we are only interested regarding the aggregate trends in a location or maybe from a community. In that cases, these personal information, they can be entirely removed. For example, if you want to here find out that what is the rate of COVID recovery in a specific state. And because in 2020 and 2021, almost every state, they were publishing their data, I think on a weekly basis or monthly basis. And all of those data, so they were aggregated data, and but they are here, but and actually they are here. Here the right way is to remove the name and anything that is personally identifiable and which is related to personally here the protected health, and then only take those attributes which are required to answer the question. Okay. Now, yeah. So we were talking regarding health till now. So we will just here switch to another topic, and so which is natural language processing. And because here natural language processing is also known as the father of artificial intelligence. And also once we know a little bit, then we can see that how this natural language processing tools and AI tools, they can be leveraged to make improvements in this digital healthcare and telemedicine. Natural language processing, it is a field of computer science, and here the focus is that here it wants to make sense of the interactions that happen in between computers and humans, or humans and humans, and but it has to be natural language. And for example, that when we are writing something in SQL, and so I'm just taking one technical example. That if you and in case you have worked in database before, then you might know regarding structured query language SQL. And so SQL is not natural language, and so because it has a specific structure to it. And but when we talk about natural language, it is that language that we use in our speaking or writing in our day-to-day activity. Okay. And the goal is to enable the computers to understand, interpret, and generate human language in a way so that it is both meaningful and as well as useful. And there are actually multiple aspects to it. There are natural language understanding, natural language generation, and as well as speech recognition and text to speech. And text analytics is also, this is one process of extracting meaningful insight and information from unstructured text data. And typically speaking, right, when we build one model, and whenever there are some numbers, it is easier to it is easier to build the model. But whenever there is text data, it becomes difficult because text data has many nuances, and sometimes same sentence can mean multiple things in multiple contexts. We will see also a few examples. So here, anytime we are dealing with text data and we are trying to derive insight from text data, that is considered as more complex compared with any other numeric fields. And applications of it, we have seen it in recommender system. If you have seen any OTT on Netflix, then I think you have already used one recommender system. And because when you watch a movie, it will recommend you movies similar to that. Similarly, there can be classifiers, sentiment analysis. From one text, we can identify whether it is positive sentiment or negative sentiment. Topic recognition from one paragraph. Using NLP tool, we can identify that what can be the topic name, and also the chatbots. Okay. Yeah. So text analytics, and so typically because here numbers are not involved, so you cannot do any kind of aggregation like you cannot do average. And so typically for text, there are few methods that are used. That is, we can do frequency analysis, that how many times a specific word is occurring, and also we can find similarity between two different texts. That is usually done through something called cosine similarity. And also contextual analysis is very much essential because depending on the context, the meaning of a specific paragraph can be different. Okay. And here you can see also one difference between numerical analysis and here text analytics, and how this numerical analysis, we can use the universal metrics. But for text analytics, we are mostly limited to few things like frequency, similarity, and we need to just derive the meaning out of the context. And also this text data, it has high dimensionality, and numerical data typically has low dimensionality. Okay. Um, okay, let me just give one example here so that I can explain that why text data is difficult to derive meaning. And so here, let's say that I have a sentence that the bank will not fail. And so could you just tell me or write in chat, what do you mean by bank? Okay. Now, if I show you these two pictures, now can you actually identify the meaning of bank in an unambiguous way? Okay. And because here the bank, it can mean here the river bank. And in case I am living close to a river, I will always be worried that here the river bank might fail and there might be flooding. Or in case I have kept here my money in fixed deposit in a bank, then I would be worried that that whether the bank can sustain and actually maybe um, some scenarios. And so in case here we are dealing with two different scenarios, but the same sentence can mean both. So these kind of scenarios are very difficult for a machine to interpret. Hmm. And so because even for humans, I think this is difficult to know unless we know the context. But here actually machines, they have one specific method through which they do identify this, that we will go through it to identify that here why exactly and how these particular data will be processed. And let me give you maybe another example. Okay. Um, so if I am writing here one paragraph and here my first sentence is that the bank will not fail, and I have a follow-up that here the river bank reinforcement is strong, it can withstand rise of river. Then computer knows that here bank means the river bank. And but if the follow-up is it has strong reserve to weather the crisis, then the computer understands that here the bank means it has, and here we are talking about the financial institution. Okay. So this is again another example that, and so let's say you have taken your wife for a lunch or dinner to a restaurant, and she says that I can tell you how much I enjoyed the meal. And but if the follow-up is that it was so delicious that the words are not enough, that means it is, and so that means that this is positive. And but in case here the follow-up is that really is this your favorite restaurant? So that can mean that she did not like the food. So here basically you can see that ambiguity that can lie in the same sentence, and that can actually have here multiple meanings. Yeah. Yeah, this is one very famous quote by J.R. Firth, that you shall know a word by the company it keeps, and that you can only know meaning of a word by looking at its context. Okay. So like this is this is here a little bit regarding that deep dive of one of the natural language processing projects that we will go through to see how sentiment analysis and topic recognition works. And because here basically I am telling you the uh, here basically that internal working mechanisms, how these NLP models work, and like later and also later I will show you how and actually you can call these algorithms also using AI. And so that is an easier way of doing it. And but I am actually here taking you through the difficult way so that you understand the internal here the internal mechanism and how exactly they work. Hmm. So let's just talk a little bit about different text analytics methods. Okay. Here there is actually one list of different text analytics methods. For example, classification. And so classification is nothing but you have actually multiple text and you want to classify that into multiple groups. So that can be that can be done through algorithms. And also it can and so it is also sometimes and also it is sometimes it can be also done through the clustering. Sentiment analysis is also one kind of classification where we determine the emotional tone and then we do classify it based on whether it is positive or negative sentiment. Topic modeling is from one particular paragraph, we try to identify what is the topic name. Okay. And vectorization, it is nothing but it is one method, and so it is just one method through which you represent words in a text in continuous numerical form in the vector space. And so because whenever we talk about machine learning models in AI or NLP, they can all take they can all take numbers. So we have to convert these text into some kind of numbers. And also once we do that, then here they can be fed to model, and that is why vectorization is really important. Yeah. And there are a few other techniques called language semantics and grammar, name entity recognition, part of speech tagging, language understanding, and translation. They can, and also these methods are also available in natural language processing. So in this particular, and I know that these are a lot, and so in the interest of time, we will just go through one deep dive of two things. One is topic modeling, and another one is sentiment analysis. And the rest, in case anybody has any questions, actually you can reach out to me later as well. Okay, now let's go to topic recognition. And here you can see that I have mentioned here one paragraph. And I would suggest that if you're able to read like on your screen, and so can you actually suggest a topic name for it? You can take maybe 10 or 20 cents, like you can actually take maybe here 10 to 20 seconds and just suggest one topic of maybe 10 words. Any volunteers? Okay, let me just make it a little bit easier for you. That if you read through it, you will identify that it is regarding some animals. I've just highlighted those portion of the text in blue. Now, can you identify the topic? Forest the real home. Yeah, that's a good one. Yeah, you are very close. Good. So here basically, when we will analyze this particular paragraph, we will identify that we are talking about the animals and their dwellings and where exactly they stay. And that is why that Yatindra had mentioned that here's basically the forest, the real home, that is an appropriate topic. Or it can be animals in forest and their dwellings. So here, let's just take a step back and identify how exactly we did it in our mind. I believe that you might have just read through it, then identify that which are the nouns and which are the verbs. And here basically you are trying to identify the part of speech and then trying to see that whether there are multiple nouns and part of speech. And then you try to categorize them. And when you categorize them, you try to identify that, okay, all of these nouns, they are basically animals. And here, all of these dwellings, they are basically where they are staying. And so one topic can be animals in forest and their dwelling. And also, and here also, that is also one of the way how these natural language processings work. And there are multiple algorithms, but actually broadly, it will do all of these things to identify the topics. Yeah. And so this is, okay, so where we are at 6:43. Okay, maybe I think we'll just go through a couple of slides here. So document similarity, it measures how closely two or more documents are. And this is one technique through which you can identify whether one particular artifact, it is closer to, it is closer to another artifact. And this particular technique is used a lot in recommender systems. And so here, for example, you have different documents like document 1, document 2, and document 3, and these are the 3 words. And you can basically here count those number of words which are there, and then you can find that similarity like through one process called a cosine similarity, that you can find its magnitude, and then you can also do its cosine multiplication, and then you can find out its answer. So you will see that from out of these 3 documents, document 1 and 2, it will be more closer than document 1 and 3 and document 2 and 3. And what it exactly means is that here, and so through this, we are projecting all of these documents as vectors into one higher dimensional plane. And then we are trying to see that which 2 documents on the higher dimensional plane, they are closer based on distance metrics. Okay. So this is basically one of the ways. And also there are other ways, like here there are also other vectorizers, that is term frequency and inverse document life frequency. Here, that count vectorizer that we saw in our last, here actually on our last slide. Here one particular demerit is that it depends on count. And so let's say you have one word, which is not very important, but it appears many times in that particular document, then it will think that it is important. And so that is why actually there was another vectorizer which was invented, which is called term frequency and inverse document frequency. And so here what it will especially do is that it will identify, and so let's say you have 5 different paragraphs. In each paragraph, it will try to identify that what are the important words. And then out of all of those 5, like here, all of those 5 different paragraphs, it will here try to identify that what features are unique to one paragraph. Then that will be the topic for that paragraph. So let me give you one example to explain this. And let's say we have 2 paragraphs, and that paragraph 1, it is regarding actually cricket and Sachin Tendulkar. And there is one paragraph 2 that is about cricket and Mahendra Singh Dhoni. So when we are trying to identify the topic, then we cannot say that actually cricket is the topic, and because that is same across both. But we have to identify that what is unique in each of them. That particular identification is done better by TF-IDF, because it can identify which are the here basically which are the unique features in each particular paragraph. Okay. Yeah. Okay. Now actually we have some idea about natural language processing, and AI. We will go to that in some time. But let me just show you that how exactly we can leverage this in telemedicine and digital healthcare. And so as we have already discussed that digital healthcare, so it will have some amount of video consultation and remote monitoring. Here actually electronic prescriptions, digital health records, multilingual translations, automatic scheduling and reminders, chatbots, clinical decision support, and also patient engagement. And so, and here maybe we can just try to think that how exactly it can be done through one NLP. Hmm. And so here basically, and so let me just show you maybe a couple of examples. And before that, we will also go through some methods, and so which are used. For example, some of the AI methods, we can use generative AI. Generative AI is nothing but there will be a prompt where there can be questions and answers, and speech recognition, agentic AI, and machine learning, robotic process automation. And some of the NLP methods like extraction, text summarization, sentiment analysis, or topic recognition. Okay. Uh, so now, now maybe I'll just give you one example, and you tell me that what you will use to actually make that particular feature available. And so let's say that we have, and so let's say that in one particular industry and one particular telemedicine platform, we want to have one application for tumor detection. And when we want to detect tumors, we want to get lot of images where actually there were tumors, and we want to train one particular model, and then we want that model to predict on the future images that whether it is tumor or not. And obviously, it will not be 100% accurate, but this is just one of those examples, right? And so do you think that it can be done through machine learning or AI? Let me see whether. Okay. And also, let me give you another example that mm, yeah. E-prescriptions. Here we are talking about electronic prescriptions. Electronic prescription, I think that will be really beneficial when the doctor and the patient they talk different languages. And so let's say that we have one patient who is from a rural area, and the doctor is not very familiar with the language from the area. And but when the patient goes for a consultation, but still, and so once, and here basically once the doctor has typed the prescription, then the translation can be sent to the patient, and then he or she can read that. And here this is another example. And also, I don't know that whether you have faced it or not, but sometimes you might have seen that, and because in India we do not have universal health record yet, and because of that, sometimes you have to do the same test at two different hospitals. And because here the doctors want to make sure that yes, and whether you have one condition or not. And so it might happen that you have reports from another hospital, but you are still required to do the test again. So these kind of inefficiencies, it can be brought down, and also the efficiency of the system can go up in case we go for digital health records. And so because once we have digital health records, so these records can be accessed by all of those, and here basically all of those healthcare providers. And so you do not have to repeat those tests, and all of your health record, it will be right there. And also another important example is that sometimes some people can have some allergies, and if they or their and so in case they are not able to tell the doctor that what are their allergies, and so sometimes that doctor might give some medication, and so that can have some side effects, and sometimes these side effects, it can be fatal. So in those cases also digital health record, in case it is there, so the doctor can just read that, and they can know, and also here they can know regarding everything of the patient. And so these are a couple of advantages of having that digital health record. And also here this natural language processing, it can help here the doctor to actually transcribe this conversation and also summarize these EMRs. Real-time transcription, yeah, that is possible. And also one of the study in USA that they had found that and one of those healthcare providers, they had reduced and their documentation by almost 40% by implementing these digital health standards. Okay. Okay. So for patient engagement, here actually there are a couple of key questions to answer. That it is important that all of the patients, and so they do have trust on the healthcare provider, and so they need to feel connected. So here one of the key questions to answer is that how that entire experience of here that entire experience of healthcare, it can be improved and it can be made easier and it can be made more delightful and here for the users. And so the desired outcome, like, and here from one ideal platform is that here the patient, they should feel a sense of connection with the platform, and they should have a higher level of satisfaction, and they should feel that it is easier, and here they have to feel that it is easy to use, and the healthcare has higher quality, and also sometimes we have seen that early interventions and continuous engagement, and so they can help in getting better outcomes. And so because here, and so in case we are collecting all of the parameters of health at here at one continuous level, and so in that way, and so there is high probability that we will discover something and it's faster than later. And that is why now we can see that, and actually we have, and here, and actually a lot of these telehealth providers, they have mobile apps or website, they have personalized tracking, reminders, and also notifications. And there are some AI chatbots that these patients can converse with, and also they can check their symptoms to identify what exactly is the disease, or simply actually they can get more information from the system. And also there are some dashboards that can actually track more progress. And also sometimes these digital and continuous engagement, and here they can make that sense of connection, and they will boost that satisfaction and outcomes. Yep. And this is again like another yeah, this is from one of the surveys from United States, and from and I think this was conducted sometime in year 2020 by Accenture, and so that said that like around 72% of patients, they prefer digitally engaged providers. That actually nobody wants to actually get all of those paper copies of all of those reports, and because they are easy to and because they are difficult to carry and also difficult to keep, and so it is better if they are all available in one of those online systems. Okay. Okay, so now like we will start this building NLP models, and but I think like we can take a 5-minute break, and then we can come back and start around 7 p.m.
Yes, sir. You can take it, sir.
Okay.
Yes, sir.
Hello. Madam, can we start?
Yes, sir. We can start.
Okay, great. Okay, and so before we proceed with that deep dive and AI, I just wanted to know, are there any questions from anybody? If you have, maybe you can write it down or you can speak. Okay, so we will proceed like just in the interest of time. And I'd also like to add something here. And we have a lot of content, right? We are talking about that overview of NLP, which is natural language processing and AI in one 90-minute session. And so that is usually a lot. And so in case any of the participants, you are building any kind of data platform and you would need maybe some guideline or just want to talk, then feel free to reach out to me, because I have actually my and also my contact information. It will be there and so on that slide, and my email information will be there. So in case you have any and so in case you have any questions, then you can reach out to me. And obviously, I think one 90-minute session, it will not be enough for you to know everything. And but that will actually give you one starting point to think that yes, this is your problem statement. So this may be one appropriate solution. And so that is basically the whole idea. And also, what is one takeaway of this?
Vivek sir, there is
Yes,
a
ma'am.
question in the chat box.
Mm-hmm.
One of the participants has asked a question: what is the best method of NLP in healthcare?
Okay. So what is the best method of NLP in healthcare? Yeah. That is a good question. And NLP is nothing but when you are processing natural language, right? So you have to think when in healthcare natural language is used. And for example, when doctor is writing the prescription, at that time they do use natural language. And also when one particular patient is mentioning what has happened to them, and also when one doctor is writing a report. And so all of these things, because they are in natural English, so here NLP techniques, they can be used for summarization and also extraction and also translation. So this is just one example how you can use these NLP models. And another example can be that, let's say you have a chatbot and you want to know their actual mental state of your patient. And so sometimes, and so let's say one particular patient is coming for a surgery and they are scared and you want to cheer them up. So like in case you have one telemedicine platform, so to the chat also, you can identify their sentiment. You can identify their sentiment, and then you can also tell something assuring to them. And so because from the sentences, you will be able to do there, you will be able to implement these NLP techniques and identify the sentiment. This is just another example. Did it help? Okay. So let me just, we will proceed. And whenever you are building one NLP model, this is the main idea, that there will be some text input, and then we have to do some amount of pre-processing. Pre-processing is necessary because the models always take numerical input. They cannot take text input. And so you can convert it into tokens. And so tokenization is nothing but you have a sentence, you have to derive those words. From words, there can be tokens. And then sometimes you can have verbs that you have to take them out. Those are known as filtering, and then stemming or lemmatization that we will go through in the next slide, and vectorization that we have already seen before. And in that actual model building phase, you will see that one specific model will be used, and also we will do cross validation, hyperparameter tuning, and all these are to find out that we will implement a couple of models, and then we will see that what model is performing best for our specific use case. And then we will use our test data on that specific model, and then we will implement that into production. And so this is just that, and so this is the actually broad process which is used for building any of those NLP models. Yeah, let me just show you one example. And yeah, this particular example is from one and so one project of restaurant review. That restaurant review mentions that so this is the review. Went in for a lunch, a steak sandwich was delicious, and Caesar salad had this. So and so this is actually pretty long review. But once we remove the stop words and we filter them out, and then we convert that to lemmatization, it becomes like this: go, lunch, steak. And so because like here, right, we had went, and so here our algorithm knows that the base word is go, and for that it will include go. And then comes in and for. They are frequently occurring words in English. They do not mean much, so that is why it will take it out. And similarly for a, so and then it had put like lunch here. And also you can define that what to filter, what not to filter based on the context. And this is just one example I am showing. And so that is why, and when you will be giving this text, then after lemmatization, you can actually get here, you can get that text like this that can go into your model. Okay. And when you will build your model, then you will have to train it first, and so you might have feature vectors, and you will be building one classifier, and then using test data, then you can evaluate its performance, and then finally, and so you have to find out that which is the model that is working best. So these things I think we have already gone through. Yeah, this is just some explanation regarding tokenization, and this is nothing but parsing the text to be collected as words. Then filtering, you can filter out anything that you do not think which are useful for like here for the model. Stemming or lemmatization, it converts the words to their roots, so that repeated words they can be considered as the same. Vectorization, then this is same as the count vectorizer and TF-IDF vectorizer that we have talked before. This basically converts your text data into some numerical form. Okay. Yeah, so this is again one of those like modeling technique. I think we'll just skip it in the interest of time. Topic modeling, yeah. Topic modeling is it is an unsupervised learning approach used for clustering documents and discovering topics based on their content. And there are actually two different algorithms which are used heavily, and which is known as here LDA, and the second one is NMF. So here this here just one thing to keep in mind was that and so in case you have higher amount of data, you can use LDA. And if you have less amount of data, then NMF is better. Non-matrix, actually that non-matrix factorization. And here the topics which are generated by LDA, they are typically more interpretable. And but in NF but in case of NMF, then they are less interpretable. And here again, based on your requirement, you can choose one of them. Okay. Okay, so we had one deep dive of one project. We will go through. Yeah, so let's just see here. I think it will be more important. Yeah. So this is a project that is sentiment, and so that basically does sentiment analysis and topic recognition on restaurant reviews, and also because this is on natural language, and so this is a similar project, and also here whatever the insights we have and the methods that are used, so they can also be used in this healthcare. And the only thing is that when you are dealing with the healthcare data, then you will have to process that data a lot, and to just make sure that it is as per the guidelines. And but once that cleaning and processing is done, then you can implement all of these methods. Okay. We will just let me go to this page. Okay. And so let's say that we have built here one of those models using and actually using using this count vectorizer and the naive bias for these restaurant reviews. And so if you have worked in machine learning before, then you might be familiar with confusion matrix. And here we basically try to find out that how many were true positive, how many were true negative. And in case something were was not predicted rightly, which is false positive and true negative, then we tend and also we tend to analyze that what might have happened. So in this also here we can see that and so especially those reviews which had these words on the left, and actually those and so they were associated with the positive reviews, and but those words which were associated with some of the negative sentiments, they are being shown on the right-hand side. I'll just bring that pointer. Okay. But here also you will see that, and actually there are a couple of things that might require our attention. For example, here, and even if it is one positive review, we are seeing that there are some words like disappoint and also here maybe like here we can, like we're talking about donut, and so from that it is evident that we were not able to capture the context. So earlier, if you remember, we talked about the context, right? And because in this particular model, we only took one word and then we had built the model. That is why we see that the context is being lost. And so because of that, we will be here building a couple of more models. Let me go to that. Yeah. Okay. Language context, it is just actually one of those reviews. I wanted to show you that why these language contexts are very essential. That like from just one word, you cannot predict whether it is positive or negative. And so because some of those reviews, they can have both actually and actually they can have both positive sentiment and negative sentiment. So the model has to derive one sentiment by looking at it as a whole. So this is one example of one review that was actually positive, but it has been predicted as negative. And because here the user has mentioned both here the user has mentioned sentences that has both positive sentiment as well as negative sentiment here. And how actually we can make sure that our model is able to identify this context. And so here actually one particular solution is that here we have to use lemmatization, and we have to use n-gram analysis. N-gram analysis is we have to, and also whenever we are considering that token, we have to consider 3 words together. And actually in that way, we will keep some of the context information. So then we built these 3 additional models. And here we did find that, so one of those new models that has performed better. And also, if we see now that because actually there are actually multiple words are there, and so on that left, you are seeing that these are the words with positive sentiment from that earlier model, which had only one word as like one unigram. And but here that model that was actually built on n-grams based on actually multiple words. So that is shown on the right. So here you can see that all of these words, they have actually positive sentiment. So your model, which is towards the right, that performs better than the model which is on the left. Similarly, for also negative sentiments, we have seen that when multiple words are considered, then your model is able to understand the context better. Okay. This is regarding the topic. Let me move to the, yeah. And actually for one specific restaurant, in case like we go about deriving the topic using those 2 algorithms, we talked about LDA and NMF. So also we can generate those topics. And so this is just like one example that for one particular restaurant, we did see that these 4 topics were generated. And also from that also we can identify that here what that particular establishment is doing good, and what it is not doing good, and what are some of the improvement areas. Okay. Next, I think we can just spend some time in AI, artificial intelligence. Okay. How many of you have used generative AI before, like ChatGPT or Gemini? Right. And I do see there is one question from Dipalika. What are some of the key challenges in telemedicine? And I believe that some of the key challenges would be, I think, the adoption of digital healthcare, because as we know that in India, the digital literacy is low in rural areas. So if we are able to adopt that technology, then I think everybody will accept it. So it depends a lot on the acceptance. And number two is like how well we are able to implement all of those guidelines around this healthcare data. And it's because there is a lot of guidelines. And so, for example, as we talked about that, and actually US has HIPAA and European Union has GDPR. So similarly, India will come up with its own standard for how to handle all of this patient data and confidential data. And if we are able to maintain that confidentiality, I think it will be a big success. And but I think till that time, and also our doctors also, they need to be more tech savvy. And I think you and also from your experience also, you might know that like some of the doctors and actually they actually may be just more familiar with writing one prescription on pen, and so maybe there we can implement handwriting recognition and also put that into computer, or they can type it directly into the computer. uh, and so earlier I was in the United States, and so there basically what happens is that whenever you are visiting there one of the healthcare facility, so the doctors usually type it directly to the computer. And so in that way, that what happens is that they will put everything into the computer, whatever their observation is, then they will derive one printout and they will give it to you. And so in that way, they are maintaining that and so that document online. And also for your reference, you can keep it offline. And whenever also you access the website, you are able to see all of those records. So these are, I think, some of the challenges. Once we reach there, then I think all of these digital healthcare and telemedicine, it will be a huge success in India. And especially because of language diversity and also and also because of high population, I think if we are able to adopt that, then like it will have a lot of positive efforts. And also we are looking forward to it that AI and NLP, it can play one really important role there. Yes. By using federated learning, we can collect this patient data without any risk. That is right. And also this federated learning is one of the ways through which actually these AI models can learn on their own. So yeah, that is another actually important methods there. Okay. So let me just go through maybe a couple of LLM applications. So it can be text generation, code generation, and also in understanding, we can have text classification, sentiment analysis, text summarization, and also question and answer, language translation, intent recognition, and named entity recognition. Okay. And earlier, I had shown you the difficult way of doing it. And but in case you want to do the easy way, and and also you have access to one system with GPUs, then maybe like you can actually call here all of those algorithms and which are related to the transformers, and then you would be able to do all of the summarization, translation, and actually really easily. And also, like here, this is actually one of like I'm actually showing you just one of those example of LLMs, and which is large language models. And sometimes also we have seen that it can be also small language models in case your data is small. And but here some of the techniques they do remain the same. Okay, so and I think like LLM architecture, it might take like long time. But let me go to another slide which might be beneficial to all. Okay. Yeah. So anytime actually, so we are building. Here basically what. Hello. Okay. 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 So last 10 minutes we'll give it for questions. Okay. Okay. Let me just go through the audience. Then, are there any questions from anybody? Does data set from other countries affect our model result according to Indian patients? Yeah, typically it should not. And why I think it should not is that because patients are different everywhere, and so that is why, and also one of those, and so one of the regulation of GDPR is that your data for a specific geography, it should not leave that geography. Okay, and so what it means is that in case you have patient data for a specific area, so it should only be aggregated with other patients in the same area, and only if it makes sense. And so let's say that you want to identify that what has been the and actually one COVID recovery rate in the entire world. And so in that case, maybe it makes sense to combine data from actually multiple areas, but otherwise it should remain local. And it should depend on all of the guidelines which has been set in that specific country. And just one slide on challenges.
I have one question to
Yes.
the entrepreneur Vivek sir.
Yes,
Sir,
madam.
my entrepreneur kindly suggests that how can a startup or healthcare institution ensure scalability and reliability while developing telemedicine platforms?
Okay. So if one startup is approaching that problem statement of building one platform for telemedicine, so I would say that it is extremely important that they need to first make themselves aware regarding the regulations, and they need to understand the rules, because in data, you have to do the filtering, and you have to make sure that your data is ready for all the tasks. And second is you need to understand the requirement that why you are building that telemedicine platform. And because we already have e-Sanjeevani, so maybe some of those features, and so they can be built. And so it is possible, but I think it is extremely essential that to know your target audience, that who you are building for. And in case that is clear, then your solution will also be used. And also it's important that you collect continuous feedback and make sure that all of those feedback is implemented in the next iterations. And so that is exactly actually I am currently showing in this slide. So if you see that point 4, that how to build the solution is that you have to put human in the loop and human centric design. So that will empower healthcare staff and as well as the patients, right? We have to take continuous feedback from them, what is required, and then build it, show it to them, and then again take their feedback and then incorporate those suggestions.
Another question is in the chat box.
Yep, I will take a look at it. How can we create one model for regional disease in India if we do not have any health data set in India? No, I think there are health data sets in India, and because there are a lot of hospitals, and in case there is no data set, then how are all of these research going on? And also there are multiple organizations like ICMR, and so they do work on different data sets. But in case it is required to collect one specific data set, I would say that again, and actually to collect information on that and so what exactly to be gathered, then have empathy regarding the patient, then seek their informed consent, and whoever agrees, then we can include that into our data set. And that ethical use of AI is actually most important there. And also that is why I have like here also mentioned that, like I have also mentioned that one of the challenges that like here we have to understand all those rules and implement that. Our success will depend on that one. Okay. And another trend, new drug development also have previous data set. Yes. Drug development is one of the really important areas, and those people who are following this healthcare industry. And so earlier, if you know, like to derive one drug, it might take, I think, 6 months to 18 months. But nowadays, because of AI, they are able to put multiple iterations at the same time. And also and so they have cut down the timeline that earlier, whatever they were doing it in 6 months, now they are doing it in, and I think within some 1 month, and it can even go down. And I think use of AI in new drug discovery phase, that is one of the most promising use of this technology. Are there any other questions from anybody? Okay, Sumati madam, and I think yes, so this is all I had to present today. And I know that we had a lot of content, but still, I would like to thank everybody to keep this particular session interactive. And in case anybody has any question, and so because I am and so because I am a data expert, so in case you have any question on building any kind of data platform or what are the guidelines of building a specific solution, feel free to reach out. I will just actually share like my email on the chat, and also after this particular talk, I will also share the text with madam.
So much, sir, for your insightful session. And over to Vasu, sir.
Thank you very much, Mr. Vivek Mishra, for delivering such an enlightening and thought-provoking talk on telemedicine, policies, platforms, and patient engagement. Your session has provided us with a comprehensive understanding of how telemedicine is transforming healthcare delivery from digital policies and technological platforms to innovative ways of improving patient participations and engagement. We truly appreciate the way you connected policy frameworks with real-world applications, sharing valuable insights from your rich professional experience in business intelligence, analytics, and natural language processing. Your perspective as a mentor and co-founder of Dollarite Consulting has further inspired us to explore the human and technological dimensions of healthcare innovation. On behalf of the organizing committee and all participants who joined online, we extend our heartfelt gratitude for your time, expertise, and commitment to knowledge sharing. We hope to have the privilege of hosting you again in future sessions. Thank you once again, sir, for an excellent and engaging presentation. Thank you.
Thank you, sir. Thank you, everyone.
Nikhil sir, good evening. Are you there? Nikhil sir? Nikhil sir, can you hear me? Nikhil sir, good evening. Nikhil sir, good evening. Sir, unmute yourself.
Yes. That was the key. Sorry for the inconvenience. I just unmuted. Earlier I was there, but I was not able to get you.
Good evening, sir. Sir, over to Prakriti Misra. Now, moving on to our second session of the evening, we will be exploring another crucial area in modern healthcare technology, wearable devices and real-time health analytics. This session will highlight how wearable technology are empowering individuals and clinicians through continuous monitoring, personalized insights, and preventive care. Our esteemed speaker for this session is Mr. Nikhil Ranjan Naik. To formally introduce our distinguished speaker, I now invite Rasmikant Mahapatra to present a brief introduction. Over to you, sir.
Thank you very much, ma'am. A very good evening to all of you, all the participants in this evening. Today's speaker, Mr. Nikhil Ranjan Naik, I don't think I can tell more about him because he has already taken one session on the first day of the last session on the first day, and he is very good. He has very good experience in the respective field, and let us have a glance through his profile. And I am very much proud that I got a chance to introduce her. So he is currently working as GM Corporate IT Systems, Apollo Hospitals. First, concerned with his past experience, he has worked as a GM Analytics Strategy, Apollo Hospitals, Hyderabad, from 2021 till 2025. Currently, he is on sabbatical and consulting journey as a Chief Innovative Officer for Fidelity Systems Private Limited. And he is having a digital transformation leader over 18 years of progressive experience in healthcare, IT, and operations, with delivering measurable outcomes across ERP implementations, healthcare analytics, enterprise data governance, and digital ecosystem development. Next experience, he has a general manager, corporate IT and strategy, Apollo Hospital, and he has been multi-million-dollar projects such as Salesforce, Mantra ERP, Oracle, Hyperion, FCCS, PCNCS, and PVCS, and Apollo 24/7, impacting 34 plus hospitals across 6 regions. He has adopted at strategy planning, business process re-engineering, and clinical CRM with proven track record in designing and deploying sales and referral engagement platforms, generating over 800 million monthly revenue. This is a very good achievement. Thank you, sir. Congratulations. And he has certified PMP, CIPP, CIPM, Scrum Master, CHA, ITIL Wave 3, and Prince 2 practitioner. He combines cross-functional team leadership, data-driven decision-making, and compliance-oriented governance to align IT with business strategy. He is recognized as thought leader in healthcare digital innovation and brings unparalleled expertise in integrating clinical systems, cloud platforms, and advanced analytics to drive enterprise-wide transformation. Today's session, I am very sure it is going to be very interesting because Sir is with us and he has very good experience in the respective field. And everybody please have a patience and enjoy the session today. Over to you, sir. Thank you very much.
Thank you very much for a very long introduction of me. I'm a small man who has done whatever the time has permitted me. I thank to Trident Technologies, your principal DN Patnaik ji, and Dr. Maya Naik ji, Sumati Madam. And there's a special thank to mention, I'm a student of my ex-professor who is there, Dr. P.K. Mohanty, MBA Dean. So today we stand because of their blessings, and I take this pride and privilege to say and thank you everybody around here, the technical as well as the academic fraternity, because they made us what we are today. So to say, uh, all the blessings from academicians only makes us come to the proud, privileged place, and I'm blessed with that. I'll say just I'm just a good implementer who implements whatever is there. So I more focus on the design of it, because when we study something with the ABC nuts and bolts. But when we design, you get to know how to integrate it, how to come with this. So my perspective always, when you are given a task, look at the history. That is how the product development. I'll be very soon looking into product development in one of the cases, maybe this thing. Let me come back to straight to the topic. Now it is second session. People will be there. People just tell me if I am able to. People can see my slide. Yeah, people can see my slide.
Visible.
Yeah, anytime I will make it this thing. Anytime yesterday, 2 days before session was monologue. I just went on explaining. I thought people are very much into this. I will very less time to question and answer session. Here we will have this. So I've got two videos. So people, whenever the audio issue is there, please let me know. I'll start with wearable devices and real-time health analytics. And since we are talking emerging trends in health technology itself comes with the word called health. So health aggregator, health this ecosystem starts with a hospital by normal definition. I go to the market space, then come back. So the market space also last time I've said India as a medtech sector is rapidly evolving with the 30 billion industry by 2030. And with that, a lot of government initiatives like Ayushman Bharat, Digital Mission, Make in India, Startup, Niti Aayog, BIRAC, and Atal Innovation Mission, and all these things are there. So budding entrepreneurs and startup guys are going to come, and at the end, after a few, 10, 15 years of experience in industry, precisely 18 plus, I just ventured into my way to think of, let put my feet into the water to know how much deep I can work. So that is where I got into Fidelcia Technologies, and the sector overview. Tech made leadership of India is basically, this $12 billion, what we say in 2024 was by MedTech India is the largest in Asia. But while 35 billion worth of, 2023 is there, so everybody is eyeing what all we can do in the health tech and that space. Health tech is a very, very big domain. So we can look into, and wearables are even more precise and more interesting and challenging. So let us start with the future starts here. What I say is industry is our is from breaking into the breakthrough. That 1 trillion opportunity is there, because when your economy says this is the money and we say 30, 35, this 1 trillion opportunity is there because too many people are venturing into this, and everywhere gadgets are coming. So what will be there in 2025? Revolutionary health trends in 2025 will be some groundbreaking technology like AI, ML, now IoT, and then sensors all has come. So this is reshaping the and enhancing the efficiency of individuals to success, understand their health information more easily. See, here I took a word called individual. I am aware of my health issue. I am aware of my take. Earlier, my parents would be concerned about me. My friends would be concerned hospital, and this it was others issue. Now, because these wearable things are there, I'm not a doctor, but I understand what issue I have. So that is what is the revolutionary trends in 2025. That is where the wearables, IoT, MIoT, AIoT, IIoT, I for industry, A for artificial intelligence, M for medical IoT. All these things are coming into picture. If you look at the right side of my slide, it says by 2035, healthcare will be proactive. Okay, so you go from your side only, approach, find out what you want. How do you want to be? More of glamour industries, physiotherapy, gymming and all these things. They are all healthcare part of it. We say wellness industry, not healthcare, but wellness industry. That is how it is. Why now? Costs are breaking the system. See, earlier, everybody was scared about this, but these wearable devices, preventive measures, wellness industry is making, is cost sensitive. So you are getting something done in 10,000 rupees. I'll make it in, less than that. That is what. This transformation is about outdated cost. So you go to a city MRI to make it in any big organization like 10,000, somebody else is doing that in 6,000. So you see the cost advantages. He is using a technology, but the printing solution is half of the cost. CT-MRI may be the same cost in the market space. So the printing technology is substituting cost factor here. So like success will require a new operating model. See, this new operating model is like, the point of time, everything was done by a person. Now it's outsourced. You are good at, designing, give it to you. Okay, like recently in an Indian context, everybody is very proud of Indian context of, cheap designing. This cheap designing model we are designing, but models, those are foundry activities done in Taiwan or China or somewhere. They come back here again, they make it. So who is best in that? So you give a franchisee model, you got a tie-up model, you got a what we say service oriented model. So who can provide the service, we give it. The most of the efficient mix and match culture coming into the picture. So that is where I will say, do you believe protect and status quo, all the innovation is divided because you are good in something, we take your help. Earlier it was like me and I exist, my brand, my name, only this was there. But now innovation is divided, somebody sitting in like the IT industry started revolution, helping out India because somebody is sitting in America, sleeping in India, somebody is working for him. So this innovation is divided. I'll tell you, a pathology lab for Germany, taking 4 hours of difference has been done in Apollo, Hyderabad. And by the time they get up in the evening, they've given midnight, there is a flight, early morning flight, reaches by 4 hours later. Sample has come in the evening, 4 hours later, 8 o'clock to 12 o'clock, 12 midnight, 4 o'clock is the processing time. The next day, the sample results are going. Okay, so it was some point of time visualized by somebody where we all were saying these are a dream. Yeah, why people are talking like this? Be practical, but that was the truth. We could make it. So innovation is this thing. So in this case, I said a super consumer emerges. Super consumer means as a consumer, my demand is more precise because I have a lot of choices. Okay, I'm more precise on what I want, and I'm more precise on what technology I'll follow. More precise on where I should go. I'll go to for a hospital sector in Bhubaneswar. If you go to Sham, you go to Trident. This Apollo. You go to Utkal, XYZ places. You have more choices because there are availability of technology, people, process, everything in space. See, I say future is arriving faster than we think. Why? The tech-enabled parent and caregivers. So earlier, doctors, nurses were there who has to come to a place, they will give it. You come rush to the hospital, dispensary, your clinic to get a caregiver. Now over the phone, over the SMS, over the internet, you get all these things done. So even if a patient is at their home, somebody can say, you do this particular process, do this, inject this one, give this medication, this is thing. This burden, keeping older people, somebody has to be watching what all these things are gone. So the institutionalize of something is gone. It is more of personalized in home care. So that has come. So second, new kind of house calls. Rural patients are diagnostic before symptoms emerges. Receive high quality data rich care at home. So since we know what is your BP, what is your oxygen level, what is your sugar level, what is this, so we say instantly say you take these measures. Okay, so you have a breathing issue. Okay, you do this palpitation issue, you do this. That is where this virtual infrastructure is giving it. And one case is there. No, you just send a WhatsApp message, recordings, readings, and facial expressions. From there, they will immediately identify. So it is not, and the delivery is also with a drone. It is coming. It's Western world is going on that way because remote healthcare and I've been exposed to Europe. Part of it is very very difficult. Somebody is 40, 50 miles away from the city to get anything kind of thing. If you think your health is an issue, you don't have any reach except it's a digital mode. The return of the physicians is become data orchestrated at AI tries risk, the personalized care and focus on the clinical judgment over administrative burden. See, earlier it was like, you go through whole 1 year file of Mr. Nikhil to find out what all has been his history, medical history, what is he, food habits, what is his cultural behavior, what is his normal, whether he has some instant like addictions or is there instances which is abnormal comes in a particular situation. All these things are now is digital there, so they just follow a pattern, identify a pattern, do is so the physicians to analyze and give, they are being handhold by these AI technologies and other technologies, so where the relevance of spending that much of time and finding out, analyzing and putting out, saying, this is our analysis, it takes in a few minutes and comes out. See, last time I think I have told a name called Dozy. In Bhubaneswar, if you go, it's a very small, like a button kind of a thing which is put into the shoulder. Recording of fever is done very frequently. So each 1 hour it puts a message which is interface to the application. It says, so you constantly want to monitor. You need not worry about going, getting nurses reaching you, then trying out because the kid is there and this. So those things are very easy now. So that is what physicians have the time. They get to know 12 o'clock or this, 1 o'clock is this. Okay, the pattern changes, so I'll change the drug. Okay, the hospitals and sites of care reimagine. It is like no more hospital would be the hospital. Your home care has changed the whole dimension of this thing. Sites of where you want to take care of it. Like destination marriages, destination hospitalizations are there. You would be very surprised to know there are cases where people, celebrities come for taking out the fat, taking out, you doing the plastic surgery, somewhere heart related issues as well. Okay. Uh, there is something what I have not mentioned in this. I'm saying chelation, and so some people say CHE, that is chelation or chelation therapy. You need not go for a stenting, angiogram and all these things. What they do is technically they break that cholesterol part of it, like it's rubbing a sandpaper on some, stain paper, stain iron. So it is internally been rubbed up on this. So there are two theories. Why you injecting something for 5, 10, 2, 3 type of 4 sessions where you are getting it that thing cleared. Why don't you put a stent which is a permanent? Again, it can reoccur. The other part of it, Germany believes in that. They have nearly, like our homeopathy practice, they have a practitioners who do these things specifically because the cases are very high, cholesterol level and the health care level is very high on this. So those are certain things, you don't come to the hospital. They can come and do, like today, physiotherapy at doorsteps are coming. This enables wearable sensors, medical IoT devices, wearable monitors, and these biosensors will feed, and there is a command center or central repository where it goes, and you can distribute it. You can find out your prescribed doctor. You find out the attendant doctor. It reaches to them. So constantly they are accessible at the point of care. Indirectly, they are not physically connected to you. So here I'll try to show something, and I hope this time it works for me. Mm. So, sir, is it audible to everybody? Is it audible to everybody? Hello. Yeah. Audible?
Yes, sir.
My video is audible?
Yes, sir. So you're audible,
Okay,
sir.
great. Okay, great. Just have a look at this. This will give you some brief idea what I'm telling. And this is a virtual break for everybody.
But video sound is not coming, sir.
Video sound is not audible?
No.
Sorry, video sound is not audible?
No, sir. Your voice is audible, but video sound is not coming.
Okay, just give me a second. Yesterday I tried to fix up. So today I will fix up that one. Ma'am, it is audible now? I think it is audible.
Imagine seeing 19 patients in a single day, missing your daughter's soccer game, ending the night buried under forms.
My video voice is audible, please?
Yes, sir. Yes, sir. It is
Okay, great.
Follow-ups and fatigue. This is Dr. Jalen Roy. This is not life as he imagined it. In just 10 years, the overburdened physician could be a thing of the past, replaced by an empowered caregiver working at the leading edge of a reimagined healthcare system. Preventative, personalized, predictive, and delivered at the point of care. Care meets patients where they are, not the other way around. AI flags, Dr. Roy acts. His work is seamless, data-powered, and deeply human, so he can focus on what matters most. Better care when patients need it, wherever they are. Hi, Dr. Roy. Meet Claire, mother of 3 and caregiver to her father with Alzheimer's. Her mornings used to begin in a fog of worry, but now she knows more about her family's health than ever before without having to visit the doctor's office.
Hey Claire, your father has taken his medicine and is doing great.
By 2035, millions will live with chronic illnesses, requiring constant care. Technology is the bridge, giving her father dignity and independence, and giving Claire something she hasn't had in years: peace of mind. Monitoring her kids' health is easier too. What once would have required a doctor's visit can be handled with the click of a camera, offering a quick diagnosis and prescription.
Would you like this delivered?
Healthcare is ever present but invisible, wrapped around her life, not interrupting it. Imagine living in a rural community, hours from the nearest clinic, with silence outside your window matched only by the distance to care. This is Michael. His AFib is under control thanks to medication and regular check-ins, but he knows how quickly a good day can take a turn.
Let's check in. Just a few questions.
Within minutes, he's connected to Dr. Roy, who's ready to treat him. The data from the test streams instantly.
Michael, your results show early signs of cardiac stress. I'm updating your treatment plan and sending you new medication.
Shortly after, a drone delivers the medication to his home.
Today's health, stable.
This isn't just telehealth, it's precision care without borders, bringing expert hands to places where distance once meant delay. Imagine growing older with a home system that keeps watch over your health, where every quiet alert is a gentle nudge to act before small problems become big ones. Priya is 76 and in good health, but a notification about her liver connects her with Dr. Roy. Together, Dr. Roy and his AI assistant run real-time simulations mapping possible causes and outcomes.
Priya, I'd like you to come in today for a scan.
Care arrives without chaos, just a seamless handoff to the next step. The minimally invasive nanotherapeutic procedure is done. Her liver function restored. Hospitals are no longer the center of care. They're a bridge to what comes next. Now, Dr. Roy works as a true care orchestrator, guiding the right treatment at the right moment, Burnout replaced by balance. The workday ends when it should. The future of healthcare is not a place we go. It's a system we choose to build together. At PwC, we're reimagining a system that's smarter, more human. This is the leading edge of healthcare, and it starts now.
Yep. I think team, it sounded is what is how things are going across. See my PPT again. Theming the digital technology and the future of living. So based on that, what is the background of all these things? When I come to say some story, so the story has a previous history, then the present, then the future we are building on what we are designing and trying to tell about the variables and all. See, wherever it goes, you try to understand one thing. The whole thing, healthcare system, the biology and the physiology of people, then the technology comes into picture where they read it, try to adapt it, try to analyze and depict something. That is what is the outcome of this. So that is that human part of this thing is this biological sequencing and all these things comes into. It's like too many things in one go. But biology is decoding the human operating system and enabling the precision at a scale. See, what I say in this, the nomenclature itself say these humans are very different. And then operating system of each one, like Western US healthcare is something, Indian healthcare something. If you say Middle East healthcare, it's a mix of it. Okay. If you go to Chinese healthcare, it's very different. Everything is traditional, but they're high tech wise, they are way ahead of time. You see, if we are telling India, US is 10 years ahead and China is 30 years ahead or 50 years ahead, people what they say. So that is what enabling the precision at scale. So if you design for a scale, I've been privileged to work with organization with 74 hospitals, implementing one application at a 74 hospital running. I know what is the advantage as well as pain is the experience itself. So you cannot think of a small solution and you can go. The scaling should be 5 years ahead. What should be the demand of hardware, software, people, process? What time the number of hits will come? We knew in a 915 to 1010 would be number of concurrent users will reach from 110 to 750 in a hospital like Bhubaneswar. So one door is knocked by 750 people. So the performance issue will come. Some other thing will come. Indent issue, written clinical analysis, all these things are lab, and lab will hit 3,000 per day. Processing by 4:30. So evening, everybody is worried about why system is getting down. So this is a factor which we have experienced. So coming back to this scaling and the precision and the human decoding and all these things. See, healthcare is one where fundamental shift is having reactive treatment to proactive and predictive to personalized care. So you have now health checkups coming up. Every time you see the labs are saying we are doing this kind of tests at this point of time, and there is a scheme for elderly people. There is a heart week, there is a kidney week, there is a breast cancer week, and there is a n number of events they try to do in the camps. That is where a personalized care is coming. What that personalized care, you go from your side, do the test, find out whether you are physically fit, whether your the symptoms are right, your body is reactive or proactive. So okay, reactive means you have some kind of allergy or some treatment is needed. You're not confident of a certain kind of a situation. All this. So proactive, you are going your side, trying to check out, then say, okay, this I have a sugar case close to boundary. Let me check. And predictive one and personal care, I'll tell you one story. 2% digital twin, which I last time spoke, is basically I've done my DNA test when I'm at the age of 35 to 40. Privileged to have my daughter. So when she just 7 years, I did a DNA check, paying something around 35,000, which seemed costly. But I got to know she will always be thin. She cannot be fat. If she is fat, she is getting obese. I cannot get rid of anything. I cannot do anything. See, this is the DNA pattern which I, so since I'm in healthcare, previous I understood. I'm a case where, at 40, 45, I should have heart case. But what is stopping me at reaching at 50s? It is the food habit. I am a vegetarian by normal choice. I did not like it. And avid professional who enjoys, martial art and all. So there are two factors which is actually helping me out of all these symptoms, which is designed so. My DNA is designed so I will have this issue. But what is the preventive way I am gone? Which is by normal instinct, I am a vegetarian and I do a lot of exercise, enjoy playing and all these things. That has kept me into this. So my doctors at Chennai, they were very surprised. Your cholesterol is 626. Are you a man? While going, you will just pass away. You don't know how it can be possible. You are doing. I thank to one of my friend, Dr. Srinivas, who studied in Europe for quite a time. He said, you must be in some extreme sports. Yes, that was the finding. So those are certain things, which comes out when you try to find out, all these things. So coming back to the topic here again, digital twin adoption, this 25% today. Last time somebody asked me, Dr. Preeti or somebody asked me how much in Indian cases. See, actually digital twin doesn't go that way. See, if I know my heart case, I give all details for 5 years, 10 years. So I can create a digital twin of my heart. If I have a kidney issue coming up and I know family has a kidney issue for last 3 generation, I get all data, put it, I realize, okay, these are the fluid intake, these are the things, this is the age where I get it. Okay. So very small thing which impacts everybody here. Friends, you can try out there. One gynecologist telling me, I don't get tired. I was surprised. I am also in young age of 35. I'm getting tired. I says, doctor, you are not a cardiologist, nothing, but how you are running? And see, just drinks a solution called nitro. That means some element, nitrogen, is there in that, like a glucose, like a water. Anybody can try that, take that, and nobody says in a way, beyond 40, you start not like, you don't generate nitrogen in your body. So nitrogen shortage means like deep water, oxygen, nitrogen has to mix to maintain the pressure. Your body is losing the pressure balance. So the BP story starts from there. Nobody says this. If you can intake nitrogen subsequently, and you maintain that pressure, so you will not have to carry a BP medicine. Doctor says, go to a BP medicine, do it. You take it very easily. First time, you look like, very excited when you get a medication. Like we get specs in class 10th and 12th. Eh? We look intelligent and so some kind of, that kind of feeling comes. Then when you realize, then coming back to genomic sequencing, earlier one sequence finding our DNA was there, but now this is identified by predictive and, genomic sequence, what kind of a DNA is there, can we customize that, where you customize, and how do you do, how much time it takes, all these things are time pressed and, it is coming. And then gene therapies has come, people now very much, people, smart people are doing what, when you are having a baby, initially you do this therapy to find out is there any genetic defect is there. When in mother's womb, these genetic defects can be identified and can be cured. Why do you come out to the world? Then you try to give a lot of time, effort, and all these things. So these gene therapies and all these things are also creating this. See, I come back to the same point, variables. So how does it come? Where do we get the data? And how do we try to predict that this is what is the reality and this is where we want to get this kid out of mother's womb with all the corrections? These are all tests, variables, things will come back. And